My name is Dr. Owen Kaluwa, the WHO representative in South Africa. I was reassigned here to South Africa in January 2020, and that was at the beginning of COVID. So I've been here in South Africa throughout the period in which we have had the COVID-19 pandemic. It was absolutely important that the world hears how the staff of WHO in South Africa committed themselves to the point of personal sacrifice so that they could work together with their counterparts in the National Department of Health and in the provinces in addressing COVID, a new disease for which we never had any countermeasures, and they were prepared to put their lives on the line to be able to go and support in the service of humanity. At the beginning of the pandemic here in South Africa, we had the first case on the 5th of March 2020. And by the 26th of April, the country had gone into a hard lockdown, which was level 5 lockdown. But just before we got there, and having received permission from the Ministry of Health to be able to go and work at provinces, because I strongly felt that WHO would best make a difference if we worked at the provincial level. After I had given permission that I would go to the province with my staff, but knowing that we are dealing with a disease for which we didn't have any solutions and responses at the time, I called my staff and asked them that we need to deploy to the field. And then when I told them, I also said to them, but you are not compelled to go, because I understood very well the risks. And I said, I will understand if some of you are not able to go. All of my staff came back to me and told me they are willing to be deployed. And to me, I felt that was one of the highest commitment the staff could sacrifice. So they did go to the field. But what was the key issue there was at that point, all the shops were closed. Only a few shops were operational, the supermarkets. And they were only selling cold food. Hot food had been banned at that time. And also hotel accommodation was not there. Only a few guest houses were operational. And the travel was also not easy because we had to carry certificates indicating that you are essential travel. They went through all this, ate the cold food that they got, just heated up in microwave, under difficult circumstances, but they sacrificed all that to be able to go and provide the service. My major concern also at the time was that my staff would go out there at a time when the UN had announced that everybody should work from home. But I felt that as WHO, we have to be at the forefront of this and join our counterparts in the health sector, particularly the National Department of Health and Provincial Department of Health, and work with them to respond. So we went to the field, my staff went to the field and really worked there, away from their families, not knowing whether they'll be safe or not, but they were out there. And this, I believe, is a strong commitment that they showed. And I think that WHO, as one of the best staff in public health, and one of the greatest commitment, and very humbling in terms of the commitment that they show. So it was important that the world knows that apart from the technical expertise, the staff, at least the ones that I worked with here in South Africa, have indicated that they have a very high commitment for the cause for which they are employed. Lucky enough, none of my staff in those difficult times got infected by COVID. But we did lose some members of staff. And every time when you think about that, you can see the sacrifice and the toll that went through. These are stories that are never told, but it's important to tell them so that people understand the human side of the sacrifice of our staff. During that time of hard lockdown, I still had to work. I still had to come every day to the office. I still had to go to the field to supervise my staff, because I believed I cannot let my staff go out there and then I remain at home. So I did go out also to the field and visited them in the various provinces, even during the period of hard lockdown and difficulties. And every time I came home, my concern was, would I bring COVID home? So that was one of the issues that was also always concerning me. And the other issue also was the fact that I've sent out all these members of staff. Yes, they have committed to go. But at the end of the day, if they go there, I was worried every time, what if someone gets COVID there and dies out of COVID? Particularly that the UN had said we should work from home. It was going to be very difficult for me to explain why I still had to put people in line of danger. But I felt we had to do it because we had to deal with COVID. With whatever information we had, whatever tools we had to confront COVID and address it. So what is important out of that is the fact that I believe in this response we have also contributed to building capacity in public health emergency response within the country. We have learned lessons that we have also used because we carried out a number of intra-action reviews and some after-action reviews. And the lessons we learned from there are helping us, working together with our counterparts in government, to strengthen preparedness so that we are better, the country is better prepared next time. When, because it's not a question of if, when we get another serious public health emergency as the COVID-19.